Hey, welcome. My name is Rachel Smith, and this is the Natural Health Rising podcast. I am a certified functional diagnostic nutrition practitioner and the owner of Natural Health Rising, which is my online holistic functional medicine company where I help people who have autoimmune diseases, chronic illnesses, mystery symptoms, and a whole host of other imbalances restore their health by natural means. On this podcast, you're going to hear conversations between myself and other health experts on functional medicine and general holistic health. My goal is to provide you with the tools you need in order to help you rise to your healthiest and happiest self.
So on this episode, I have the pleasure of speaking with Dr. Alyssa Dweck. Dr. Dweck has been named a top doctor by both New York Magazine and Westchester Magazine and has appeared on The Today Show and Good Day LA. Dr. Dweck is the co-author of 3 books, including The Complete A to Z for Your V, The Sexual Spark, and V for Vagina. In addition, Dr. Dweck is the Chief Medical Officer of Bonafide, a company providing natural remedies and solutions for the hormonally induced symptoms that occur throughout women's lives with an effective, safe alternative to hormone replacement therapy. Welcome, Dr. Dweck.
Thank you so much for having me. Thank you for that introduction.
Yeah, I am excited to talk to you today. I always like to dive into people's stories in the beginning, just kind of hearing more about you a little bit and really what got you into this line of work.
Yes. So, I'm one of those people who just really is drawn to all kinds of drama. And when I was about 15 or 16, the usual type of search for a summer job came upon me, and I decided to work in a hospital nearby that was a super busy hospital. And lo and behold, where did they throw me? They put me in the labor and delivery suite of an incredibly busy ward as the clerk. So I sort of did all of the, clerical responsibilities there. I was hooked right away, just seeing all these women coming in, excited, scared, moaning because they were getting ready to have a baby. I really found that so many of the people that I met, particularly the physicians, were such mentors to me. So the rest is history. I pursued medicine straight out of college. I also have a background in nutrition. And, so I speak the gynecology language. I've been practicing OBGYN for about 25 plus years. And throughout this time, I realized I really had a talent for, but also a real interest in speaking to the masses of just regular lay people about my field of work, thus the books. My nutrition background really led me towards working with the Bonafide Health company because it's sort of an intersection between the natural supplement world and the traditional medical world that I come from. So it was a really natural fit for me.
Mm-hmm. Amazing. What a cool opportunity for you to be thrown into the delivery room and just see these beautiful experiences happening all the time.
It was amazing, especially because they could have put me like in the pathology lab or the morgue or something. So I lucked out.
I agree, because when I was in school, I also volunteered at a hospital for a while, and I got put in the trauma and emergency center, and I was cleaning up trauma scenes, and it was absolutely terrifying. So quite a different,
but good drama there. But yeah, I totally understand. It's the luck of the draw.
Yeah, both exciting experiences. Awesome. So I want to start off by talking a little bit about perimenopause. So can you explain exactly what's happening to a woman's body during this time, and like what age this is happening and what should happen there?
Yeah, probably best to start with the formal definition of menopause, which is 12 consecutive months without menstruation for no other obvious reason, typically after the age of 40. Perimenopause are those 4 to 8, sometimes even longer periods of time, those 4 to 8 years leading up to menopause, where hormonal changes are occurring, but they may not be quite as obvious. What's really going on is that ovulation, which typically occurs during the reproductive years in an effort to get pregnant, starts to occur less frequently and then eventually not at all. So the typical, very well orchestrated hormonal changes with estrogen, progesterone, testosterone that typically occur with ovulation are not occurring or not occurring as frequently or in an organized fashion. So symptoms occur during that time. The most iconic symptom that occurs early in perimenopause would be irregular bleeding, some sort of menstrual change to let people know that something is going on.
Mm-hmm. Okay. So what can women do at this stage in their life? Are there certain supplements they should be taking, lifestyle changes they should be making?
Yeah. Well, let's start with lifestyle because I think that's something that everybody needs to buy into. Diet is super important, both during perimenopause and menopause, especially because many will struggle with weight maintenance during this time. So really modifying diet, and I don't mean being on a weight loss diet, but really having a good diet lifestyle, such as the Mediterranean diet, is going to be particularly helpful. Number 2 would be exercise. Best to get on an exercise plan before you're facing some of these struggles, when you can really start to build a little bit more muscle mass and manage your metabolism. So we usually recommend a good amount, maybe 150 minutes a week of cardio, and also weight training, flexibility and balance training, because these are all going to help out in future, maybe when bones get weaker or when balance isn't as good. So best to start early. And then lastly would be stress reductive measures, whether it's meditation, whether it's yoga, whether it's exercise, whatever that may be, because that's going to serve people really well as they traverse perimenopause. In terms of symptoms that might need management, other than the alteration in menstrual flow, which can sometimes be managed hormonally and sometimes is managed surgically and sometimes is not managed, but just reassurance is provided, many people will start to complain about what we call vasomotor symptoms, hot flashes, night sweats, interrupted sleep. This can be managed with hormonal therapy, but we see so many people who are not interested or are unable to take hormone therapy. So luckily we have other options. And you asked about supplements. So Bonafide Health, the company that I work with, has multiple supplements. One in particular comes to mind called Relizen, which is made with a Swedish flower pollen and probably works through serotonin pathways in the brain to help with management of hot flashes and night sweats. And the beauty of this company is that they actually rely on good clinical research to support effective, safe use of their supplements. So we've seen many studies over the years to support that Relizen works well for hot flashes, works well for night sweats, helps to improve quality of life as a result of mitigating these symptoms, and has been really shown to be safe. So I think that's really important. And the biggest bonus for many is that it is non-hormonal and doesn't have any hormonal pathways like some of the other over-the-counter herbal supplements do, which are called phytoestrogens. And I'm happy to speak to that. I'm happy to speak to hormones and other medications in the pharmacology world that we use to treat these symptoms as well.
Yeah. So it sounds like the supplement you're talking about helps manage certain things like hot flashes, like you're saying. What are your thoughts on using herbs that support hormones like Vitex for progesterone or black cohosh for estrogen, those kinds of things?
Yeah. So black cohosh, I have a good amount of experience with. This is what's termed a phytoestrogen. So it's not for everybody because there may be some estrogenic properties. And so women maybe who have had estrogen dependent cancers like breast cancer may have to really limit or avoid use of these products depending on their individual histories. The other thing with black cohosh is that there is a very high placebo effect, which is good. That means people are feeling better after using this, but we're not really sure whether it's due to just the placebo effect or the actual supplement itself. Finally, my patients who use black cohosh and are happy with it, I typically will want to check their liver enzymes in maybe 6 months after use and every 6 months to ensure that there is no elevation, because this is one potential side effect that we can see with that particular supplement.
Okay. Affecting the liver. Got it.
Yeah. And,
okay.
I always want to mention this as well, because I am a traditionally trained physician. Herbal supplements are real. They have active compounds. If people are taking other medications or who have other health ailments, and I specifically think about something like taking a blood thinner, This often interferes with herbal supplements. So please do check in with your own provider to make sure that supplements would be appropriate in your particular case.
Yes, absolutely. Thank you for saying that. It's very important to do. Okay. Do you have what are your thoughts on things like soy for nutrition? I feel like that's one that is kind of a battle between people on, is it good or is it bad for estrogen and different things?
Yeah, I think soy is great in moderation. Soy is a wonderful source of protein, especially with so many people wanting to really get involved with a more plant-based diet. So soy goes a long way when it comes to good, healthful calories and higher protein. We do know that the Asian diets have much more soy, and I don't believe that they have a much higher chance of estrogen-dependent cancers. Nonetheless, their other environmental exposures may be different. So I think it's important, again, to use individual medical history. Now, what am I saying? If somebody has a history of breast cancer 10 years ago and wants to eat a couple of edamame beans, no problem. But we would certainly give caution when it comes to using soy supplementation in larger doses on an everyday or multiple time a day basis.
Mm-hmm. Okay. If we're going into menopause, so let's move into the next stage. What's going to happen at this point in the woman's body?
Yeah. So during menopause, there will be no bleeding. So that is one thing that does not need to be managed. During menopause, there is not a chance of pregnancy, and you do not need to watch for fertility or to prevent pregnancy. That's something that does need to be taken into account during perimenopause. So a lot of my perimenopausal patients don't realize they actually still need to use some sort of contraception, whether it's a condom or oral contraception or an IUD or something along that line. In menopause, this is no longer necessary. Symptoms of hot flashes, night sweats, what we call vasomotor symptoms, they may last for a particular period of time. The average amount of time that we know about is about 7.5 years. That's been shown in study. Some people will have symptoms for much less than that, others for much longer. So this is still a symptom that needs to be managed. I'd say sleep interruption is a big deal for lots of women, and quality of sleep, because so many women in menopause will wake up from a hot flash, let's just say, and even though the hot flash subsides, they start to struggle with the busy mind and loads of thoughts, and they can't get back to sleep for that purpose. So this is where mindfulness training or other stress reductive measures will come in handy, especially if they're started early on. We also see, as a later symptom, but a super distressing symptom, vaginal dryness and difficulty with intercourse because of discomfort. This is extremely common, and this is one of those symptoms that we kind of label as chronic and progressive. It's not going to get better by itself, but it absolutely can be managed over the long term. So what do we usually advise? Well, of course, there's always hormone. We can use estrogen in the vagina, and plenty of people do rely on this. Other people really need to or want to shy away from anything hormonal, so they'll use a moisturizer in the vagina on a regular basis, similar to like when we use face cream every day. So Bonafide actually does make a hyaluronic acid containing insert that goes in the vagina 2 or 3 times a week to really help mitigate those symptoms of dryness and painful intercourse. This, along with a lubricant, a good lubricant that's used during intimacy, can be game changers for people so that they can still maintain an active and comfortable sexual life.
Okay, awesome. So is there anything wrong in your mind with hormone replacement therapy? I feel like, I'm hearing you say that a lot of people try and shy away from it. Are there negative side effects? Like, why would people be shying away from this?
Yeah. Well, a while back, I'm sure you've heard of this study called the WHI, which of course studied a very, very large cohort of women on a particular variety of hormone replacement therapy. An increased risk of breast cancer was noted in one particular arm of this study, and it was notable enough that they actually stopped that arm of the study. This sent the hormone replacement prescriptions and recommendations plummeting. So that's where the need for alternatives really started. With that said, over time, we realized that some of the results were really not interpreted 100% right. So that for the right person, hormone replacement is excellent. It definitely treats the symptoms. People are quite happy with it. They don't suffer adverse effects, but it is something that needs to be kept in mind. The package label of anything containing estrogen is going to say, may increase risk of breast cancer, may increase risk of uterine cancer, may increase risk of cardiovascular event, including stroke or heart attack or blood clot. So this is real and it needs to be taken into account. Who cannot take hormone replacement therapy? Women who have had an estrogen-dependent cancer, breast cancer, uterus cancer. For the most part, with certain caveats, this is off the table for them because nobody wants to risk a recurrence of their cancer.
Mm-hmm.
Number two, some women are born with a genetic propensity towards blood clot. It's nothing they caused. It's nothing that came from the environment. They're just born with a gene that might be defective and increased risk of blood clot. These are people who cannot take estrogen because their risk of blood clot, particularly going to the lung and really causing an adverse event, it's not acceptable. So that's something to keep in mind. Women who have migraine headache with aura, the kind where like you might lose your vision or your speech, something diagnosed by a practitioner, including a neurologist, these women may have a higher chance of stroke on hormone replacement containing estrogen. So I think it's most important to know that everything needs to be individualized. So hormone replacement is great for some, not appropriate for others. And then it's a shared decision made with providers and people to see what will be best.
Okay. If someone doesn't know if they have that genetic blood clotting piece, is that a test that a HRT doctor would check for before, or is there something specific they would want to ask for?
Yeah, that usually will come about with a family history or some sort of personal medical history that will kind of be a giveaway to do some testing. So for example, some women may have had a blood clot in their past, like perhaps during a pregnancy where estrogen levels are super high. That would prompt testing to see whether one of these genes is present. Some women will just have a family history. Oh, my mom and my sister and my aunt, my mother's sister, all had blood clots, and that might be an impetus to do some blood testing on somebody before you start them on hormone replacement. Some people have had an event on a birth control pill that contains estrogen. So it's usually more of the art of medicine where you're really inquiring about a family history, a personal medical history, and that type of thing. But it's not automatic blood testing that's done like with routine blood work during your well woman visit. Got it.
Okay. So you touched on like the vaginal dryness, sexual piece with women with menopause. Low libido is also going to be pretty common with that too, right? Is there anything a woman can do to enhance that part?
Yeah. How much time do you have?
We've got a while left.
Low libido is complicated for women. So for one, hormonal changes absolutely can influence libido. So I think that just sort of goes without saying. With that said, there are so many other nuances. If somebody's having sexual pain, of course their libido is going to drop because after all, who wants to do something that is going to be painful? So that anticipation of pain causes avoidance, which leads to lower libido. So naturally correcting that dryness and addressing that pain will naturally help to increase libido. Number two, and again, remember many menopausal women have maybe been through one or maybe more relationships. So you do have to examine that because there's a big portion of women whose libidos are low for their current partner, but maybe if they had some novelty or something, another partner that they might be interested in, their libido would be fine. So that's something to think about. And this is a situation that I always ask about because I'm not really qualified to help with that, but rather my mental health colleagues who work on marriage counseling or couples counseling or whatnot would really be a good referral. Number three, medical issues. Somebody with heart disease, diabetes, cancer of some sort, a pain syndrome, arthritis. These are people who may have some challenges and need to make accommodation to have a more pleasurable sexual life. So this is something that needs to be addressed, and that just falls under general medical optimization. And then finally, hormonal changes can be addressed. So oftentimes we will use estrogen, whether it's topical in the vagina or systemic if there are other symptoms like hot flashes that need to be addressed. Oftentimes we will add testosterone to this regimen. This is a hormone that, typically noted as a male hormone, but we all make testosterone, and this level declines significantly with age. So sometimes we will supplement with that, even though it's not FDA approved for women. It's still used commonly with caution. There are certain supplements that will help to enhance the sexual experience. They're not going to make you think of sex, but they will make it a better experience once you're engaged. So for women who are looking to enhance that, Ristella is a supplement, again, from Bonafide Health that is containing a strong antioxidant called pycnogenol, which helps to enhance blood flow to the genital area during the sexual response. Where we really have found this helpful is in women with depression who are on medications that might impair their libido or their orgasm potential. So this has been shown in clinical study to help with that particular issue. And then one final thing I want to mention, because it really is so common, especially these days and after the pandemic, weight. If women are not feeling sexy because they're unhappy with their tone or weight, managing that will be helpful, because after all, if they don't feel sexy, they're not going to feel sexual. And that's for themselves, not necessarily for their partners. So weight management, exercise, and that type of lifestyle management, like we spoke about earlier, is very helpful.
Yeah, I'm glad you mentioned all of those extra things, because I think it's easy for someone to think, oh, well, if I just do hormones or something, but then thinking about, well, am I actually confident in my body? Am I happy with myself? Am I happy with my marriage, my relationship? Like,
it's a biopsychosocial, medical. There's so many nuances. I mean, look, for some women who are just so super busy, they're very stressed out. They just literally have a to-do list that's a mile long. We have to sometimes tell them to plan sex, to put it in their calendar, doctor's orders to put everything else on the back burner for a short time. Or we have to instruct them on what we call bibliotherapy. Start reading some erotic stuff, start watching some movies that are suggestive, whatever your comfort level is, romance, like outright porn, whatever works. And that will get the sort of the thoughts flowing. And then privacy for some women can be an issue if they have kids at home, because men seem to be able to put all that on the back burner. But if a woman hears her children in the door or is worried somebody's going to walk in, that's going to, be a buzzkill. So a lock on the door is often recommended.
Okay. Well, while we're on the topic of sexual health and everything, what's the rate of women who don't actually have an orgasm?
So I think that gets broken down a little bit. I don't know what the statistic of is somebody who's never had one ever in their lifetime, or what that stat would be based on age, but this is what I do know. The standard quote is that 70% of women will not orgasm from intercourse or penetration alone. That direct clitoral stimulation is typically necessary. So this is something that needs to be communicated to a male partner, because they may not be able to read the mind about this. And so communication, particularly direct communication, is very important. So I think that number is a reasonable one. Certainly it goes up for people on certain antidepressants and that type of thing.
Yeah, I just want to touch on that. I find it fascinating because I think it's something that I think that could also be an issue with the libido pieces, a woman feeling like self-conscious of that kind of stuff. And then again, if you don't have that communication piece or know how to make that happen, then that kind of can be thrown in the mix of everything there too.
Absolutely. And, I always hate to bring this subject up, but it's necessary. We always, when we're doing a consultation for libido that's lower, we always ask about a history of abuse or a history of some sort of trauma in past, or the value system that somebody may have been brought up with that might, really make sexual relations only for procreation, or that it was a negative experience at some point that we need to get through. Again, I rely on my mental health colleagues to really help us through those issues.
Yeah. Do you have some that work with you in your practice, or is it just kind of you refer out for that?
I refer out for that. We don't have them in our practice, but that's okay. We have great ones in my community. And then there's also a wonderful organization called ASECT, which is it's an organization, a professional organization of mental health providers who focus on sexual health, and they are, certified in a particular way.
Mm-hmm. Okay. I want to go back to menopause for just 1 second here. Do you see it becoming more common that people are going through menopause earlier than they quote unquote should?
What I do see, which I think is a good thing, is that women and providers and basically everybody is talking about this a little bit more. So whether people are actually going through earlier or we're just more aware of it at an earlier time, I think the jury's still out. Mm-hmm. What I also know is that there are documented risk factors for going through an earlier menopause. So for example, genetic factors. If your mom and all your sisters had menopause in their very early 40s, it's very possible that you will have a similar experience. Smokers tend to have an earlier and more notable menopause, but earlier age of onset. So those are two things. And there are, of course, other environmental factors as well.
Okay. Yeah. Are there, if you want to speak about some other causes of early menopause, do you have any other things you can provide there?
Well, early menopause means menopause before the age of 45, which should be distinguished from what is called premature menopause or premature ovarian insufficiency or failure, which is before the age of 40. That has a whole different bucket of reasons for occurring, usually some sort of an autoimmune issue or some sort of treatment like a cancer treatment or medication or radiation that may have altered, the age of natural menopause. Surgery surely can alter the age of menopause and the experience. Treatments for different diseases or conditions can alter age of menopause. I would say that stress, and I don't mean just like a little bit of stress, but like an overwhelming stress, like the loss of somebody, horrifying grief, a move that was, very stressful. Sometimes those can bring on a death of a family member, something along that line. We've seen people literally have their last menstrual flow right at that time and never to get it back again.
Okay. I heard you mention autoimmune diseases. Would you say all autoimmune diseases are going to increase that, or is it specific ones?
There is an autoimmune connection to premature ovarian failure or premature menopause.
Okay, so just overall.
Yeah, it's considered to be possibly an autoimmune condition, but it's a distinct one. It's not like if you have a thyroid autoimmune issue, you're going to go through an automatic premature menopause. It's more of its own condition.
Okay, got it. Now I know you help people with like vaginal health overall. Is there any other tips on that piece of how can a woman optimize that, whether it's food or probiotic supplements, whatever things that they can do for that?
Right. Well, it's funny. Some women can literally use any products on their vagina or vulva and go about their day with no issue whatsoever. Keep in mind that I see a distinct population in my patient population, and they're all coming in with a problem. So those women who can get away with using any products, they're not really coming to see me other than for their regular exam. But those who come in with constant infection, irritation, discharge, odor, that just seems to be recurrent over and over, may be suffering from what we call dysbiosis. Their vaginal microbiome is out of whack. It's unbalanced. The amount of good bacteria and the amount of bad bacteria and other organisms are just out of balance, and it can cause symptoms and even outright infection. We usually, for this population, recommend avoidance of anything that could be potentially allergenic. So fragrant products, whether it's tampons, body washes, we definitely suggest to avoid the practice of douching, which is still somewhat popular. We talk about using white toilet paper, something undyed, maybe changing pads, tampons to something organic or cotton to get out of your wet workout clothes or bathing suit right away so that bacteria and yeast don't have a very moist environment to thrive in. Those are things. We also speak about diet. People who have super high sugar or alcohol diets may be more prone to infection. And then, of course, sexual activity. So, sexual health goes hand in hand with vaginal health. Multiple partners, lack of condom use, certain spermicides, these can all alter the biome and cause symptoms. Does that sort of answer your question? I would also say that hormone changes in general. So whether it's due to birth control pills, that's hormonal, or menopausal transition or menopause in general, or even pregnancy because of the alteration that's pretty notable in hormones can increase risk of that biome being disrupted.
Yeah, a couple things on this. So I heard you mention high sugar and high alcohol diets. I definitely agree with that. I do functional lab testing in my practice. So I'll look at gut health and vitamins and minerals and all sorts of different things. And I definitely see a correlation with the women who are coming in with frequent UTIs and yeast infections, having a yeast overgrowth in their gut and other parasites or things going on. And a lot of times once we address those, and that also goes along with eating an anti-inflammatory diet and getting rid of those refined sugars and alcohol and things like that. So just want to say, I totally agree with that one.
Yeah. I don't know how you feel about probiotics. I know they're all the rage right now, but we are specifically interested in probiotics geared towards feminine health. Which usually just contain different strains of that good bacteria than maybe some of the gut health probiotics. Either way, my patients definitely seem to benefit from them, especially if they are suffering with documented recurrent yeast or bacterial vaginosis infections. And in fact, Claire V, which is a probiotic specifically designed for feminine health, taken for 15 days of each month on a regular basis each month. This is brought to us by Bonafide Health, has been studied. And we do see that the specific strains actually make it from oral consumption to the vagina based on vaginal colonization studies. So I think that's important.
Oh, yeah. Do you know some of the strains that are in there?
Yeah, so Claire V contains Lactobacilli acidophilus and Lactobacillus rhamnosus. Also contains a prebiotic called lactoferrin, which I'm sure you're familiar with, which tends to maintain the viability of these strains so that they can traverse the gut and land where they're supposed to. And then this is a capsule in capsule, which I'm sure you've seen before. They're super cool. So the liquid that surrounds it not only, again, maintains the viability of the strains to make it through the gut, but also contains folic acid so that it is, we know that women who have low folic acid have more severe BV. So that was a strategic ingredient.
Oh, I love that. That is awesome.
Yeah.
And I heard you say something about tampons and pads. Do you ever recommend vaginal cups over those things?
I sure do. Yeah. So the vaginal cups that are most appealing to me as a gynecologist are those made from medical grade silicone. So they're pretty inert. I think, after the learning curve, which of course can be a little messy and frustrating at first, these can be a game changer because they don't absorb the menstrual flow, they collect it. So, when you think about a tampon, for example, and believe me, I'm not bashing tampons, they're great for loads of people, especially athletes. But they absorb and they can even dry out the vagina and change the biome if you are wearing a tampon that's too absorbent for your flow. And everybody knows that awful feeling of pulling out a dryer tampon. It's quite uncomfortable. We have found that women who suffer with recurrent infection over and over might benefit from using a menstrual cup because they're not dealing with that absorption. A pad, of course, again, I'm a big fan of pads for people who like to use them. But, if you're wearing one even for just a couple of hours, the moisture builds up. Some of it is wicked away, but just moisture in general, even just from perspiration, is a prime breeding ground for bacteria and yeast. So you need to change often. But again, for those people with multiple infections, a menstrual cup could help. One caveat, if somebody is using an IUD with a menstrual cup, they really do need to work on their technique for removal so you don't, suction out or dislodge your IUD.
Okay, that is a good point. I didn't think about that. But yeah, I like how you said once you get over the learning curve, because they're a little tricky in the beginning, but totally worth it. Yeah.
They are. And certainly they are a lot less expensive than some of the other products.
Yeah, absolutely. Do you ever see a lot of women with PMDD?
I do.
Okay.
I do. I think I guess what I should say is that I see a lot of women with PMS.
Mm-hmm.
PMDD is a much more severe form of PMS, usually diagnosed and managed by a mental health therapist because these women are really suffering. But, there's a fine line between that transition, PMS or PMDD. But yes, I do. And, oftentimes we'll use an antidepressant low dose for this. Oftentimes we'll use supplements, particularly one called Serenol, which again, studies behind it to suggest how helpful it is for PMS. But real PMDD with the standard DSM-5 criteria needs to be managed and watched with a mental health provider because, sometimes these women really are suffering beyond what they should be and need further attention.
Mm-hmm. And if you can't speak to this, that's okay. But have you seen hormone replacement therapy or hormone drops or anything like that work quickly to help those symptoms with someone with PMDD? Or is that something that's going to take a while to get through those mental, emotional, really serious symptoms?
Yeah, I would have to say that I think that the PMDD is cyclical by definition. So it does occur on a cyclical basis with the hormonal shifts. But many, many times there's a correlation or a combination with some depression, some other anxiety, and maybe other things going on. So again, I do my part with maybe birth control pills for regulation, maybe one of these supplements, but I think this type of person who's having their day-to-day life activities and their relationships interfered with by their emotional symptoms during their cycle is best addressed by a mental health therapist. Antidepressants work really well, and that's typically what's used.
Mm-hmm. Okay. Is there anything important that we missed that you want to chat about before we end?
I think two things that I always like to leave these interviews with, which is number one, menopause should be faced with optimism because there are good things that occur during this time. And since it's inevitable, you might as well face it with optimism rather than the other way around because it's going to occur. And I also think that we're lucky because these subject matters are being brought up now very commonly, whereas even a couple years back, they weren't. And I think many more people were suffering as a result of that. So now it's really on the radar for so many more people.
Mm-hmm. You said face menopause with optimism. What could make someone look at it differently?
Yeah. Number one, no bleeding. So that's a big deal. People have been having their bleeding habits interfere with their lives for a very long time. We see missed school, missed work as a result of menstrual discomforts or bleeding or whatnot. Of course, we do see missed work as a result of menopausal symptoms as well, but at least no bleeding. Number two, freedom from having to worry about fertility and or contraception, depending on where you stood. So I think that's something which certainly causes sadness for some women, but really can be a liberating thing for many other people. Third, at the time of menopause, many, many people are really at the pinnacles of their careers. They've, maybe had their families and are watching their kids launch. They might have more confidence or wisdom. So I just think we have to really embrace those things.
Mm-hmm. Oh, I love that perspective. Yeah. Well, one final question that I like to ask everyone is if you could leave the listeners with one thing that they could do, implement into their lives this week to help them live a healthier, happier life, what would that be?
Wow. Well, that's a very broad question. So from my angle as a gynecologist, I would say just take care of your vagina.
Okay. Yeah, I love that. First response like that on the show.
I figured I would leave you with something that was unique.
Yes. No one will forget that one. Well, thank you so much. You've provided some amazing information today. So you can go ahead and share any final thoughts and then also how people can find you online.
Yeah, please look me up at hellobonafide.com. I'm the chief medical officer, and I think there's wonderful education on the site, most of which I have vetted or written. So I trust that information is valid and credible. And my latest book, like you mentioned, is the complete A to Z for your V. And now you know what V stands for.
Mm-hmm. I love it. And we'll have the links to your books and websites and everything in the podcast notes.
Fantastic. Thank you.
Thank you.
Thanks for watching the episode. I really hope you enjoyed it. And if you did, make sure that you like the video and leave a comment and share it with a friend who really needs to hear it. Because when you share this information, you're also going to help other people level up their health. And if you or somebody else you know wants to work on their health and they're looking for a functional medicine practitioner, feel free to reach out to me to apply to work together. Thanks for watching, and keep striving to become your healthiest, happiest self.